go all the way back and keep a mask or something.
Yes, that's going to be a good way of doing sexual custody.
Let's close that down.
That's kind of not quite my dirty for me.
Okay. I think we should be live. I'll turn the sound up just in case.
Where can you see the questions?
I will say them to you, yeah. Okay,
So
yeah. You guys are live. There you go, you can see viewers up there at the moment.
Oh, hello, one viewer.
It's probably Wendy.
Yeah, absolutely. Right, let me get this up on here.
Hello, lovely people. We are Natalie and Miranda, and we've got lovely Matron Wendy with us today. And we're live from the Cotswold Birth Centre in Chipping Norton. And we are basically here to answer any of your questions about antenatal care. And Wendy's going to read them out to us, so fire away if you've got any questions.
We are definitely live. Do you want to talk about, while we're getting started, just about antenatal care in general, like the schedule of care and how it works and like when you're referred for your booking appointment? Just to start people off.
We normally like to meet you after you found out you're pregnant. Normally your booking midwife appointment would be kind of between 8 weeks and 10 weeks. Sometimes people will see their GP first, and when you first find out you're pregnant, often the first thing to do is to call your GP and let them know, and they will kind of talk to you about what kind of supplements you should be taking early in pregnancy, so things like folic acid and vitamin D and just pregnancy vitamins, and they would kind of direct you to the midwife and send a referral for a scan as well.
Yeah, you'd meet us, have some blood tests, find out about your schedule of care, meet your midwife, have some kind of general observations like blood pressure and things like that taken, get your pregnancy notes and lots of information alongside that, like screening information. Then you'd have your 12-week scan, and then you come back to see us at 16 weeks, and there's a whole host of appointments after that that are all in your notes.
There's only normally 3 scans that we offer in the pregnancy, so the dating scan around 12 weeks, and they can offer screening for trisomy syndromes, a 20-week anomaly scan where they have a really in-depth look at your baby's kind of all of their bones and their heart, and then the 36-week scan where it's normally just like a growth scan and to check that your baby's in a great position.
And then as part of the 20-week scan, they're looking at blood flow through the baby, and if that's normal or within normal parameters, and if that's raised or reduced, they might offer you some additional growth scans. And thinking about placental location as well is something that is also of interest to them at 20-week scan. So that's quite a thorough scan, that one. Some people choose to have private scans, in which case we can work with those as well. But generally it's the 12, 20 and 36 week scans in this trust.
Well, we've got 26 people watching now, so just a reminder, hi, over here. This is about antenatal care. So drop us any questions. It can be anything from even pre-conception, so trying for a baby, all the way up to sort of planning for your birth. We've had one little comment from Charlotte. Hi Charlotte, and she says hope you're okay and keeping safe, and hello to Naomi as well. So we'll just keep talking about sort of the antenatal schedule. We're going to go through sort of how the appointments work and when you see a midwife, and then we'll ask questions as they come in. What do you get to? 20-week scan.
Yeah, so kind of going back to the beginning, the first appointment is generally the longest one. Takes roughly an hour. We gather lots of information about you, your medical history, your family history, any medical conditions you might have, any medications you're taking. And at that point, we're trying to establish whether you would be a low-risk pregnancy, so kind of just being looked after by a midwife, or if you might need any consultant input for any reason. And that could be some initial input or all the way through the pregnancy. And we also have a more high-risk clinic called the Silver Star Clinic, which they deal with things that are that bit more high risk, and at what point you need referral. And then generally after that, appointments are about half an hour long.
Normal midwife appointment consists of us, we kind of just do your blood pressure, we check your urine every time that you come, we just check for things like protein in terms of things like preeclampsia, if you've ever heard of it, which is a condition that's not common in pregnancy but we're really hot on. We also, from 16 weeks onwards, we'll try and have a listen in to baby, and a little bit later in the pregnancy, normally from your 25 or 28 week appointment, we will start measuring your baby as well, and just measuring your tummy from the top of where we feel your baby bump starting down to your pubic bone.
Most of the time we're just screening that everything is staying within normal parameters, and if it's ever outside of those parameters, then we can make additional arrangements for extra monitoring, like extra scans, extra blood pressure checks, some blood tests maybe, and we also have a 24-hour unit based at the John Radcliffe, and also a day assessment unit based at the Horton in Banbury, which they can review you if things are outside of the realms of normal, or if you ever just need any care, 3 a.m. in the morning, or those type of things, that there's somebody always there to answer your questions or signpost you or review you.
So we just had 2 questions. Charlotte is asking where we are, so should we just do another round of introductions? Now we've got 29 viewers.
Hey, 29 people.
We are at the Cotswold Birth Centre in Chippenham Norton, talking about antenatal care regimes and any questions about things that happen antenatally or before you find out you're pregnant. And this is Natalie, I'm Miranda, and we have Wendy, one of the matrons of this.
So we are community midwives, and this is one of the standalone midwife-led units that facilitate birth. We also have antenatal care here, alongside some of the GP practices, and we offer postnatal care, so care after baby's born, the normal routine checks, as well as coming out to see you at home, and breastfeeding support as well. We are quite renowned for our breastfeeding support in this area. We're very lucky we have this lovely unit.
So Lisa's asking, hi Lisa, I'm due to have a section at 37 weeks due to twin pregnancy. When should I expect to receive a date for the section? I'm currently 30 weeks.
So I think it's normally kind of the last consultant appointment that you'd have before you have your babies. Normally,
I think you'll probably have a scan at 32 weeks,
yes,
because it's twins, and they might start making plans for birth then. It would be depending on the ultrasound. Would you agree, ladies?
Yeah, lots of factors to kind of factor in. But yeah, the consultants will be keen to set a date with you, but it will all be depending on growth of babies and if that's looking normal.
So Kaylee says, hi Kaylee, I am 17 weeks and I'm really struggling with hip pain and my hips are clicking every time I move. I was just wondering if this is normal. I'm in agony every day and most of the evenings I'm in tears of trying to sleep. I'm really sorry, Kaylee, that sounds rubbish.
So whilst not completely normal, it can be quite common for women to have problems with kind of hips, pelvis, back, pain in pregnancy because of the additional weight of the uterus. It sounds like you're experiencing this quite early on, and I don't know if you've got any other history of issues in that area, but it's definitely something that we can help you with. If you're not due to see a midwife soon, so you may be seeing her at 20 or 25 weeks, then I'd definitely get in touch with your midwife and just ask about a physio referral. There's also a really helpful website called the Pelvic Partnership. If you have a little look on their website, it gives you lots of help and support in terms of exercises, ways that you can keep the pain at bay, and also it encourages hands-on manipulation. So it's worth having a little look at that website and speaking to your midwife about referrals we can make to help.
Okay, I've not heard of that, so that was actually really helpful for me as well. Naomi, clearly, I bow to your knowledge. Naomi Kelly says, what COVID restrictions are currently in place? So do you want to talk about restrictions for during antenatal appointments?
Yeah, so far, when you're coming to any antenatal appointments, we still hope and ask you to do a lateral flow test within 72 hours of attending, and obviously only coming if that's negative. We'd ask you not to come with any symptoms, and it's absolutely fine for you to come with your allocated birth partner or support partner that you have in pregnancy, as long as kind of they're well as well. In labour, we know that this has just changed, and now you can have 2 birth partners when you're in labour, and just still the same support partner the rest of the time in hospital.
When you're coming to your appointments, we'd ask that you wear a face covering unless you're exempt, same for your support partner, and you'd be expecting us to be wearing PPE as well.
I think it's the same for scans as well, that you can still have one person with you and still wearing a face covering and hopefully having done a lateral flow.
And if you're ever really, really struggling to get hold of lateral flows, quite often we'll have some at your appointments or at the GP practice, but ideally you can try and order them online, which becoming more difficult. So we understand those difficulties, but if you can try and get a little stash for your pregnancy and do one before you come, that would be really appreciated.
So Scarlett asks, hello, hi Scarlett, are you allowed 2 people to come to hospital yet? I'm having a section in 3 weeks. And your mum usually comes and waits until you've had the baby. As far as I'm aware, Scarlett, I am here. The 2 birth partner rule is for labour only at the moment. It's always under review, but for now, for anyone having an elective caesarean, it's still 1 birth partner.
That's always been the same theatre, hasn't it? Always.
Yeah. So you can
like that in theatre, as it is,
there's a little shout out again from Charlotte here to when she's pregnant with her daughter, Alessia, and so that's right, or Alicia. Zoe looked after her, and also Sharon, they were amazing.
Oh, we will pass on your thanks.
And then that's it at the moment. So where will we up to with our antenatal schedules?
Because we're covering stuff.
We talked a little bit about booking, scans, screening.
16 weeks. After the 16-week appointment, if it's your first baby, we'd hope to see you again at 25 weeks, or if there was any kind of additional risk factors we were worried about in the pregnancy, we'd see you then. If it's not your first baby and there's kind of nothing that we need to observe in your pregnancy, we might not see you again until 28 weeks, which is quite a larger gap. But from then, we see you really routinely. Either after 28 weeks, we might see you at 31 weeks, we definitely see you at 34 weeks, and kind of 2 weekly from that point. The last appointment with the midwife is normally 41 weeks if you haven't had your baby by that point. And if it was getting kind of that late in your pregnancy, we'd kind of be having those discussions about what to expect with induction at that point.
I'll clear those notifications in a minute. Do you want to talk about smoking and carbon monoxide screening in pregnancy?
So at the beginning of your pregnancy, when we see you for some booking bloods and things like that, you would expect to be asked by your midwife if you were happy to have some CO monitoring, and that is looking at the risks of carbon monoxide. So we know it's a poisonous gas, but it has no smell, no odour, no colour, so it's looking at the risks of CO, and it's just an opportunity for screening, and also encouraging you to have a CO monitor at home. We don't just screen people that are smokers or have been smokers in the past, we screen everybody, and that's because sometimes CO2 readings can be high in areas where the pollution is high, or can very occasionally pick up things like dodgy boilers or poorly fitted log burners and things like that. But we offer CO2 monitoring at least twice in your pregnancy, often at booking and often again at around 36 weeks. If you are a smoker, then it's something that we might want to keep an eye on more regularly, and we'll also offer you some smoking cessation support in pregnancy, should you wish to have it. We might keep an eye on those levels more regularly. We'd hope to be seeing them come down with some support to stop smoking if you wish. If we were a non-smoker and we picked up some CO2 levels, then we could try and help you to come to the bottom of why that was. And what else screening-wise are we talking about? CO2 monitoring and what we do. Smoking,
Can go on to some vaccines earlier.
Yeah, you feel confident talking about COVID vaccine?
Yeah.
Yeah. The big three.
Three vaccines in the pregnancy. So the flu vaccine we recommend through the winter months, just as women who are pregnant are more at risk of becoming unwell with the flu. So you can have that. Yeah, normally they don't offer it throughout the summer. However, they should still be offering it at the moment, and you can have that any time in the pregnancy. Whooping cough is something that we recommend only from 16 weeks pregnant, and it is kind of designed to get your body to create an immune reaction to a whooping cough vaccine, so you pass on that immunity to your baby, so it covers them for the first few weeks of life and gives them some protection until they're old enough to have their own vaccines. And then last one is the COVID vaccine, which we do recommend in pregnancy, and kind of for all three, if you're completely unvaccinated or if you've had some level of vaccination already, we recommend everything up to the booster.
And you can safely have that at any point in pregnancy. I also appreciate some people decide to wait until after the first trimester. The JCVI, who kind of tests the vaccine, and they recommend that it is safe at any point in pregnancy. And you can get most of your vaccines via your health centre, and the COVID one just from the COVID vaccination programme online. Sometimes the flu vaccine is available at scan clinics if you haven't managed to get it via the GP or nurse. Often we'll talk to you about what vaccines we recommend at appropriate appointments.
We can talk about, because I feel under pressure as well, on foods to avoid and healthy eating in pregnancy.
Yeah.
Well, I'm testing it.
So what I would say is when you're pregnant, Google can be your friend, but also can also be your enemy. So if you Google stuff, just make sure that you are putting NHS at the end of it, so you are getting reputable information, because there's a lot of information on the internet, and some of it is wonderful, but some of it is not true. A lot of information changes over the years as well. So whilst your granny might be really helpful in telling you to avoid eggs in pregnancy, actually the advice has changed on that. So if you just look at foods to avoid in pregnancy on the NHS website, also caffeine levels in pregnancy is really helpful for most people, and also some of the unknown things about the risks of toxoplasmosis, which is mostly surrounding the risks of cat litter and also lambing. If you've got a toddler at this time and you're early pregnant, we ask you to avoid going to a lambing session at a local farm and things like that, just because of the risks of this bacteria that can be quite harmful in pregnancy.
I'll keep saying this down.
Play it back to ourselves. Any other questions?
Is it drugs?
No.
And paracetamol is kind of thought to be safe in pregnancy, just to take the smallest dose for the shortest amount of time possible that is needed, but to avoid NSAIDs, so things like ibuprofen.
Yeah, and if you have any ailments or flu or anything like that in your pregnancy, cough or a cold, your local pharmacist can be really, really helpful in terms of what's safe to take in pregnancy, as well as your midwife. A lot of things do say avoid in pregnancy or ask your healthcare professional in the packet, and that's mostly because we can't ethically test really in pregnancy, but your midwife, pharmacy or GP will be able to guide you.
So Louise has asked, hi Louise, is there any NHS advice around placenta pills? I'm assuming she means encapsulation.
Yeah.
I think there is.
Yeah, any regulated advice?
Personal preference.
Understand the reasoning behind it. I don't know. I don't know of any studies, but haven't particularly looked about the benefits of them or risks. But yeah, really personal choice at the moment, and is a private option if you want to have it. And
then Roxy, hi Roxy. What are the trust guidelines surrounding a gestational diabetes? I'm guessing she means women. Is there a point in which women are induced regardless of how it's controlled? Do you want to talk about just briefly gestational diabetes, sort of how community midwives manage it?
Yeah. So we screen for it routinely in some pregnancies. So if you've had gestational diabetes before, we would do the screening quite early on in the pregnancy, which is our glucose tolerance test. So for anyone that's had it or not had it, it's a 2-hour long test where we take some blood when you're fasting, give you a glucose containing drink, and then do another blood test 2 hours later just to see how your body kind of handles it and reacts to it. If we were to pick up, and then normally for anybody with a BMI of 30 or who's kind of from an at-risk ethnicity, we would offer screening a little bit later in pregnancy, normally around 24 weeks.
Or for any family history of diabetes.
Anyone who did come back with an abnormal blood result or kind of was known to be diabetic, they would be under our diabetes midwife team at the John Wycliffe, and they have quite regular appointments there with them.
Often they can just monitor their sugars at home, and it feeds back to the diabetes midwife so they can pick up any abnormalities and respond quickly. And thinking about, I think you're asking about induction levels, it often depends on how well controlled the diabetes is, and whether it's diet controlled, insulin controlled, and also the growth of the baby. So there's lots of factors to take into account. Sometimes you do see ladies that have gestational diabetes being offered induction around about the 39-week point, but it's very individual.
So we talked about induction. Yeah, so just to stress, I'm just going to close that again, I don't know what is coming up here. Just to stress that it really is an individualised conversation.
Yeah, it's a recommendation.
Yeah, so it's not sort of, the phrasing of your question makes it sound like, you have to be induced regardless of what's going on, so it really isn't like that, and we'll give you advice and then you'll be able to take that on board and in discussion with your team choose the best time for you and how you want to approach that. And she said thank you, so you've already clearly answered the question. Oh, thank you. Okay, so we've done gestational diabetes, CO, diet, medications.
Aspirin might also be something.
Yeah, that's a really good one.
So one of the things that we do try and establish at the very beginning of pregnancy is if you have any risk factors for things. And one of those things is preeclampsia, so if you've got any family history, previous history, if you already have problems with your blood pressure, one of the things that we may recommend is you commencing aspirin in the pregnancy, and that's to try and reduce risks in essence. Also, one of the things we're looking at risk factors for is, because we know the pregnant women produce extra blood volume, is your risks of developing a blood clot in pregnancy. And all of these things are, usually quite low risk things, but there are some factors that we look at to say, you might be at increased risk. And so sometimes in early pregnancy, sometimes as you go into the third trimester, or sometimes postnatally, we might be recommending some blood thinners. And as with everything, it's very individual and we'll assess those risks. So the booking especially, but at various points through your pregnancy, we're assessing your risk factors for things. And thinking about blood clots. So if at any point you develop COVID in your pregnancy, one of the things that we're asking you to do is report it to your midwife, because that might increase your risks. And so you may have had a risk factor before of 1 or 2 that may have been low risk in pregnancy, but COVID may give you that additional risk factor. So whilst it may only be a short period of increased risk, we do ask you to always tell us if you test positive at the moment for COVID. Screening-wise?
Trying to think of other. We talked about sort of different blood tests we take on later on in the pregnancy.
No.
Iron?
No. So, so the booking, the bloods that we do at the very beginning of pregnancy are the National Screening Programme for Maternity, so the same that you'd have taken anywhere. One of the things that we look at is your blood group, and we can come on to that in a moment. Your iron levels. We test for 3 infectious diseases, hepatitis B, HIV and syphilis, and 2 blood inherited disorders, sickle cell and thalassemia. And iron and antibodies we do routinely check again later in pregnancy. So the 3 routine blood tests you'd be expected to have in pregnancy would be all of those at the beginning, iron and antibodies rechecked at your 28-week appointment, and then iron routinely checked at 34 weeks. And if at any point we find that you are low on iron, or particularly symptomatic and low, so having any shortness of breath or dizziness, then there might be numerous ways of us recommending you upping that in pregnancy. We know babies taking a lot of your nutrients, and that's why we recommend a multivitamin in pregnancy. But also sometimes that's not quite enough to sustain iron levels, and so we might talk about iron-rich diet or iron supplements, and then we can manage that alongside the GP and make sure that your iron levels are coming back up before baby's born. Blood group.
Yeah, so we like to find out what blood group you are in the pregnancy, and just as well as your blood group can be a different letter, so you might kind of be A or B or O, and you can also have a rhesus negative and positive, which is just something that's either present in your blood or it's not. And so if your blood group is positive, it generally doesn't need any further action. But if your blood group is negative, there is always a chance that your baby will have inherited a positive blood group. And so we offer a test around 16 to 20 weeks to find out what blood group your baby is. And that's a non-invasive test. We take blood from your arm to find out what blood group the baby is by their free-floating DNA. And then if your baby was a blood group that's positive and your blood group is negative, we'd offer something called anti-D in the pregnancy, just to prevent any sensitization to your baby's positive blood group. And we offer those anti-D injections, which is a type of blood product, and you can discuss with your midwife kind of the pros and cons. But we offer that at 28 weeks and when you have your baby, and any other time that you might have had any trauma or bleeding in the pregnancy.
Beautifully explained. Very well educated. Hannah is asking, hi Hannah, is there any news on when the Cotswold Birth Centre will open for births? I'm 7 weeks of my due date and this is my only worry. I did think this might come up. I mean, it was a bit mean to put that in the Cotswold Birth Centre, wasn't it? And not address this. So I know that we keep saying that we're going to review it, but we genuinely are reviewing it in the next couple of weeks. Staffing is still a concern for us at Oxford, and we're doing everything we can to make sure that women who birth with us are safe. And to do that, we do need to sort of make sure that we can provide the services at the JR, and then where we can.
It's a national thing as well, so it's not just OUH, but it is obviously affecting us, and we're trying to do everything we can to keep women safe.
Yeah. So yes, we do keep saying we'll review it, but we genuinely are. I wouldn't come here if I didn't want this place reopened, and I was also semi-promoting it as well. A little bit of a tease, but hopefully for those who are earlier in this pregnancy, this will definitely be an option. It's based on online, but I definitely want to see it reopened as soon as possible. I know everyone here does as well.
And please do discuss alternatives with your midwife in the meantime. We're more than happy to kind of discuss like recommendations on home birth, or perhaps the Horton is nearby, which is a freestanding midwife-led unit that is still open at the moment, and as well as the Spires, the John Radcliffe and the delivery suite.
Beautiful.
Watch this space.
On that note, do you want to talk about birth planning?
Yeah.
Or birth choice planning or preferences planning?
There's so much paragraph. So absolutely, there's no time that's too early to start thinking about your preferences at birth and things that you'd like to happen when you do have your baby, wherever it may be. So obviously there's lots of things to think of. Many people often first think of like pain relief. So by all means, there is, if you have a look on labour pains, there is a table of all the different kinds of pain relief available to you in labour. Most of those are kind of medication versions, but alternatives that we have all over the trust, so in midwife-led units and the Spires and the delivery suite, they have things like aromatherapy and heat packs and water. They really support kind of dim lighting to try and help your oxytocin, and definitely things to think about to have in a birth plan is if you're using any kind of like hypnobirthing techniques, we'd love to see it on your birth plan just so we kind of don't so we can follow it with you,
support you in your choices.
Yeah. And who you want with you, and things as well, like who you'd like to cut the cord, if you know what you're having, if you'd like us to tell you when your baby is arriving, or if you'd like your partner to announce the gender or sex of your baby. And third stage, which is kind of when we're waiting for your placenta to be delivered. Sometimes we can make it an active third stage by giving you a medication to help your uterus contract. which reduces your chance of having a postpartum hemorrhage. But it is an intervention, and we would normally hope to deliver the placenta quite quickly with some traction in that case, or physiological third stage, in which case we leave you to it, and at some point your placenta should kind of let go of your uterus and can be delivered with your effort as well.
So one of the things we give you to look at and start thinking about at the very beginning of pregnancy is a leaflet all about birth choices. And it may be that at the very beginning there's something in your history that would indicate that it might be beneficial for you to, or recommended for you to deliver at one of the obstetric-led units like the delivery suite at the John Radcliffe. Or it may be that your pregnancy is deemed really low risk at the beginning, and we'd be recommending one of the standalone midwife-led units, or alongside midwife-led unit, or home. And we review that as the pregnancy progresses. So we recommend you having some form of antenatal education, so you can kind of know what your preferences are and how we can support you in those. And then we have a conversation at your 34-week appointment about where at the moment you're thinking of, and if we support you in that choice, if it sounds like a really sensible idea, and so we can try and help and guide you. But if at any point you're not sure, you don't know where your choices are, you just want some extra advice, that's what we're here for.
Irrespective of where you plan on having your baby, we really love it if you try and make it your own, a place that you'd be comfortable. So by all means bring like fairy lights, like the battery operated fairy lights you can get. You can bring a hot water bottle from home if it's one that you really like. You bring speakers or earphones.
Your own pillow.
Yeah, your own pillow. Anything that makes you feel a little bit more safe and homely if that's not where you're having a baby.
That was, again, brilliant. I'm definitely surplus to requirements. So, Neo. Hi, Neo. After labour and birth, will the partner have to go home and the baby only stay at the hospital if needed? Or is there any room where the partner can stay overnight? I'm happy to fill this.
Go for it.
So at the moment, the visiting is 8 to 8 generally, give or take, and unfortunately you don't have partners stay overnight. If you do give birth during the night, it's not a case that as soon as you've given birth, your partner will be asked to leave. It will be until you move into a sort of postnatal room. So unfortunately at the moment, there is no overnight facilities for partners. Again, as I keep saying, these things will be reviewed. I know it sounds really ambiguous, but we do want to see things sort of back to normal as they were pre-COVID. So it can change at the drop of a hat. So do keep an eye, especially on the MVP page. They're really good sort of announcing these changes as well to everyone. And Sandra said, hello, I have an induction booked for next Wednesday as baby is overdue. What can I expect on the day, please? Will I go home after or have to stay for monitoring? I take it I will have to go give birth at the delivery suite, was hoping to give birth at the Spires. Now, I do feel like you can ask this.
So, when, again, induction is a recommendation, it's not something you have to have, it's made kind of in conjunction with you. But when you do go for induction, you would normally have a monitoring of baby, so we call it a CTG, but it's just a continuous monitoring of your baby's heart rate that prints on a piece of paper, so we can look at kind of it as an overview and say, yes, that baby kind of has a lot of reassuring features. And from then they would offer you, it's a type of plastic balloon that we kind of insert into your cervix, and then we blow it up with water. And it's just kind of designed to put some increased pressure on your cervix and try and open it a little. That would normally stay in for 24 hours. It has changed a little bit in COVID as to kind of the capacity in the unit. It might come out a little bit less or a little bit more, and sometimes it does fall out in that 24 hours, ideally when your cervix is a couple centimetres open, in which case it's done its job. So once either that's fallen out or we take it out, normally 23 hours later actually, you would kind of just be waiting for a space to come up on the delivery suite. If you went into labour any time in that 24 hours, if your pregnancy was low risk anyway, you'd be more than welcome to go to the Spires or anywhere you wanted. Or if the idea of opening your cervix is so we can break your waters and to start off kind of the next phase of the induction. And also, if you did go into labour from us breaking your waters and you were less than 42 weeks, you are still suitable for the spires. Only when we start the next level of induction after breaking your waters is normally a hormone drip that's called Oxytocin, and is a synthetic version of the hormone that your body makes itself in labour. And when that cannula is in and we're using that hormone, we like baby to be continually monitored on the CTG, and so that would involve being on delivery suite. With that hormone and a cannula, you are still more than welcome to use a pool and water for pain relief in labour. The only kind of difference is just the location on delivery suite for that monitoring of baby. We're very careful with Oxytocin because it can affect your baby in your uterus, so we're monitoring your contractions and we're monitoring your baby, and we're increasing it from a very, very minimal rate, increasing it every half an hour until you're having regular contractions.
I think that was very thorough.
Sorry.
That's good. Sandra, I hope that answers your question. Do let us know if you want to know more specifically about inductions. Okay, what else do we cover?
Just thinking on that point. So generally, the outpatient inductions are used for those more lower risk scenarios, or scenarios such as being overdue. And I know you were saying, do you have to stay in? So generally, you wouldn't have to unless anything was deemed, that we weren't particularly happy with monitoring, or there was any other reason to keep you in overnight, for example. And then, we discussed with you. Where were we up to in terms of antenatal care?
The birth planning, weren't we?
Yeah.
Stretch the seats, maybe?
Yeah.
And when you get sort of the post-dates type time?
Yeah, so a sweep is a vaginal examination by your midwife. It is an intervention, but a more lower risk intervention in terms of trying to encourage labour along, and it is often offered. You don't have to have it. It's offered if it's your first baby from your 40-week appointment, if it's your second or subsequent baby from your 41-week appointment, and then the Trust's guidelines about going overdue, if that's just a reason, and there's no other risk factors, would be that we would be wanting to offer you induction between 10 days and 2 weeks overdue, and you could potentially have a sweep or two prior to that, depending on the suitability. And it's something that's often covered in antenatal classes, and can be discussed, and also leaflet and more information given to you about it for you to consider.
They're not always the most effective thing at sending you into labour, but even if you did have a membrane sweep, which involves just trying to separate the bag of waters from the cervix, even if that didn't send you into labour, it can still make some changes to your cervix and to make kind of labour or induction a little bit later on more favourable.
And sometimes it's good to know if there's any changes in your cervix, or if your cervix is looking like it's ready to go into labour. Some women have a bit of a show after a sweep. Some women, sweeps are not possible if we can't reach your cervix. For other women, they may go into labour the next day. So it's really individual, how ready your body is, how easily we can reach your cervix, if we're able to actually sweep around the bag of membranes, maybe stir up some hormones and get things going. And also, baby's position can be quite important in terms of working alongside a sweep. So if the cervix is opening kind of from the inside out, so if baby's head's really nicely low down and well applied to your cervix, that will really help. If baby's in a slightly kind of awkward or off position or not well applied to your cervix, then it may not work alongside the sweep. So lots of factors to take into account.
We have not got a lot of viewers now, so we're just going to start sort of wrapping up. That we've done a sort of whistle-stop tour of antenatal care. Why don't we finish on when to call in labour and who to call? As actually, we'll focus on sort of community births and spires births. So if you've got any questions, please pop them in the chat now so we don't miss them.
So if it's your first baby and you're kind of at home and your contractions have started, if they're still quite irregular, so not kind of happening consistently every few minutes, we kind of recommend that home is the best place for you if everything else is fine and your baby is moving and you're well. And we'd hope that you do keep us in the loop anyway if you're concerned about anything, but we normally invite you to wherever you're planning on having your baby, or if you're planning on having the baby at home, we'd come up to you if your contractions are about 3 and 10 minutes. And anytime if your waters break, we'd like you to tell us as well. So if you were planning on having your baby at home, your contact would be Wallingford, which the numbers are all in the front of the blue notes. Your contact would be Wallingford. If you were planning on having your baby at a midwife-led unit, it would be the place that you're planning on having your baby, so either the Horton, Wallingford or the Spires. And then if you're planning on having your baby at delivery suite, it would be contacting MAU in those cases. If it's not your first baby and you've had a baby before, then we would recommend just calling a little bit sooner, as your labour can be shorter. So if you are having maybe 2 contractions in 10 minutes, and especially when your waters break, these are just guidelines. Every labour is very different. If you feel like things are happening a lot sooner, please don't hesitate, just call, especially if you have kind of any concerns or questions. We wouldn't mind triaging you over the phone and kind of making a plan with you from there.
On that note, Liz asked, who was a lady you spoke to already, could you remind me of the guideline, how many minutes of contractions and how often to make a call to MAU? I'm a second time mum, so what would advise? Yeah.
I mean, just it's second time, we know labour can be that bit quicker, and take into account where you're birthing, how much time you might need for childcare, getting there, all those things. But just give us a heads up, call us when you think things are starting. Things may establish or become quite intense quite quickly in second labours. So just trust your body, call us when you think the time's right. It doesn't have to be a set in stone amount of contractions per minute or how long they're lasting. As a rough guide, we'd say kind of 2 contractions every 2 contractions in a 10-minute period, lasting about a minute long, or if your waters break. But if you think things are happening quickly or intensely, then just call. That's what we're here for.
And what if someone's waters break in a day, let's say a weekday? Could they call here?
Yeah. So wherever you're usually looked after, there's always calling your midwife-led unit, calling your community setting, or calling MAU or the day assessment unit for assessment. So we know that often women go into labour within 24 hours of their waters breaking, but we do want to review you if you think your waters are broken. And that's for a number of reasons. So there's the potential for increased infection. So we want to give you some pointers about things to look out for after your waters have gone. We might want to, you might be unsure if your waters have gone, so we know that you can get increased discharge, occasionally some incontinence if baby's really pressing on your bladder. And so if you're really unsure and you think you might be just leaking a bit of fluid, then do get checked over. For some women there's a huge undeniable gush, for other women there's a slow trickle, so there's not one fits all. So you can ring your community setting and get a review if your waters are broken in the day, and make a plan with your community midwife. Or if it's out of hours, there's always MAU, they're always there.
Okay, I don't think there's any more questions.
Oh!
Now I'm just opening up my email, so quick sneaky read.
Trying to close something.
Hopefully nothing
I turned it off completely then.
So on that note, thank you so much. I think you'll all join me in thanking these very wonderful midwives who've definitely done much more than I've ever done. This is my 3rd session, so I think I'm just going to get used to every single session from now on. I think there is another one in 2 weeks' time. I don't know what the subject is on, and then you'll see me again in 4 weeks' time for talking about MLU, so there's like Chicken Norton and Wallingford Birth Centres.
Okay. Keep you in the loop about what next session's about.
Yes.
Thank you for your questions and getting involved.
Bye.